We're now on to part 7 of pregnancy and human development, page 1083. And we're looking now at the changes that occurs to the mom during the time of pregnancy. So they talk here about gastrointestinal issues. So nausea and vomiting is very common, particularly in the first trimester, because there's a very sudden change and increase in the amount of estrogen and progesterone. They also note here that this initial phase here is also complicated by human chorionic gonadotropin, which is maintaining the corpus luteum of the ovary. Right, so they really attribute that type of nausea and the morning sickness to this molecule in particular. Okay, so it's that molecule in combination with a vast change in estrogen and progesterone. They're talking also, I mentioned the idea of heartburn because the interior of the abdominal cavity is a little bit challenged by the growth later in pregnancy of the uterus. It's pushing up against the stomach, and so consequently it's going to possibly cause some acid reflux there. Okay, then we come over here. It matters what we ingest at this particular time because of the critical changes that are happening with the fetus. So what that means is that there's all kinds of processed foods, of course, but beyond processing itself, there's the issue of the use of drugs of various kinds, alcohol, nicotine, various kinds of drugs that one might be taking for a variety of reasons, infections like German measles. Some drugs are really quite horrible. We discovered that thalidomide, which is actually a drug for getting to sleep at night, caused these things called teratogens, which are the changes that occur in fetal development that cause unfortunate deformities. Okay, so this particular molecule caused arms not to form properly, and there's like little flippers that come as a result. Okay, urinary system. There is the additional burden, it says, of disposing of fetal metabolic waste. So that means that the kidneys are working much harder. A woman is likely to be a little bit more tired. It's 25% of the energy of a non-pregnant woman at night, 25% of the heat of the body at night while you sleep is the kidneys. The kidneys are doing a lot of work already. So the fact that they might also be dealing with the metabolic waste of the fetus increases their work. Okay, then there's also the issue of interior pressure causing stress incontinence. So that's a possibility. Upon going from a seated to a standing position or that kind of thing, there's potentials for stress incontinence. The respiratory system, it says here, this is an interesting one that you might want to consider as to what's going on. The nasal mucosa responds to estrogen by becoming edematous and congested. There's the potential for nosebleeds from this. And then they talk here also about the fact that the diaphragm is challenged by the interior development of the uterus, and so some women are experiencing dyspnea, which means shortness of breath, during the later stages of pregnancy. Cardiovascular system. Here Dr. Marie notes that the most dramatic physiological changes occur in the cardiovascular system, and she says here the total body water rises, and blood volume may be increasing as much as 40%. So sort of good news for venous return, if you will, but challenging for things like the potential for high blood pressure. So at any rate, she says by the 32nd week, this is by the 32nd week, this 40% increase to accommodate the additional needs of the fetus. So there's kind of good news and bad news. With the extra blood, that means that if there is bleeding during childbirth, that there's a possibility that there's enough blood to spare. So there's that possibility. Cardiac output increases by 35 to 40% because you're going to be perfusing more tissue. There's the tissue of the mom, and then there's the tissue of the baby, and the uterine tissues, etc. All of those require oxygenation and perfusion for nutrients and waste products. The uterus, it says here, presses against the pelvic vessels. I mentioned this before, which may impair venous return. It results in the possibility of varicosities of veins. So the valves of the veins become incompetent in some cases, and there's at least leg edema as a result of that. Okay. So here we get to take a look now. We just looked at mom. Here is bebe. This is the fetus. And here we're looking at the very beginning here at 8 weeks, which is the end of the embryonic period. We have the beginning of what is described as fetal development. So 8 weeks is the end of 2 months. We're not quite out of the first trimester. And it says here that the head is nearly as large as the body, right? So you've got two things, head, body. And the entire project is 1 inch, 22 millimeters. Is just slightly under 1 inch in length. So it's a ½ inch for the head and a ½ inch for the body right there. Okay. Now we're at 9 to 12 weeks, 3 months, so that's the end of the first trimester, beginning of the second trimester. We have now switched from the corpus luteum, supporting all of these activities hormonally. Now we're relying on the placenta. The placenta is fully developed. Here we have an individual that looks a little bit more human. So we have a head still dominant, but the body is elongating. We have facial features present, okay, and sex is readily detected from the genitals, good to know, and that we have 3.6 inches from crown to rump, 3.6 inches, so this person has elongated quite a bit, going from 8 to 12 weeks. That's an extra month of time right there, 8 to 12. Okay, then we have 16 weeks. Yet another month has gone by, and we're at 13 to 16 weeks, month 4. Here's our individual. We have a cerebellum developing its prominence. We have blinking of the eyes. We have suckling motions of the lips. So certain activities. The face is looking human, which is an important detail. So eyes are in front. Everything is present in that regard, and most of the bones are now distinct, so that means the position of everything is ready. You can see what's going on with the limbs and so on, but still, head to crown we're at 5.5 inches, not exactly gigantic by any means. And now here they talk about month 5, and they don't give us any more pictures for that one. We have this fatty secretion that's covering the body. Okay, so silk-like hair, etc. Fetal position is now assumed because things are getting a little crowded. There's space restriction, and the limbs reach near final proportions. The quickening occurs. Mother feels spontaneous muscular activity of the fetus. So there's that aspect. From crown to rump, we're at 7.5 inches now, which is getting to be, almost the correct length. And here we are now at 21 to, this is months 6 and 7. We're out sort of like near term, and the period of substantial increase in weight is beginning to take effect. The lungs could be starting to produce surfactant, so if they're born at this point, they're not too premature. The myelination of the spinal cord is beginning. Eyes are open. Distal limb bones are beginning to ossify. It's possible that the child is, to some extent with the eyes open. One could say even there's some psychologists who think that there's a certain amount of bonding with the interior of the womb that occurs. But you can read about that in your psych books if you wish. At any rate, we have a body that's lean, well proportioned. Bone marrow becomes the sole site of blood cell formation. Okay, the testes reach the scrotum. Oftentimes this is when the descent occurs. So there's that going on. And then finally here we are at weeks 30 to 40. We're at full term, and this is birth here. Skin is white, whitish pink, fat laid down in the subcutaneous tissue. So there's a variety of factors that are enhanced with this, which is partly the ability to float in water for one thing, and the ability to not sort of take landing on surfaces is a little bit gentler, and also the child has the subcutaneous fat as a source of nutrition and energy, depending on how long it takes mom to figure out how to make everything work properly with suckling and latching and the development of breast milk and so on. We're about to look at that. Here the length on average is running somewhere around 14 inches from crown to rump. So that's also the weight here of 7 pounds is about the average to be expected at that time.